COVID-19 booster shot. Why you'll need it. Vaccine makers like Moderna are developing and testing booster shots to help immunize against the variants of the SARS-CoV-2 virus that are circulating in the US. Booster shots are also needed to increase immunity as protection from the original shot wanes. The Moderna, Pfizer-BioNTech, and Johnson & Johnson vaccines do provide protection against the virus strains circulating in the US are highly effective at reducing hospitalizations and deaths. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic. Video posting every Monday, Wednesday and Friday. To see my other videos, see the link at the end card of this video. More than half of US adults have now received at least one dose of the 3 available COVID-19 vaccines. But with the rise of virus variants and the potential for waning vaccine-induced immunity, experts are saying even the fully vaccinated may soon need booster shots. Variants driving need for boosters. Several variants of SARS-CoV-2, the virus that causes COVID-19, are circulating in the US. Some, notably B.1.351, have mutations that appear to reduce the effectiveness of the COVID-19 vaccines that are currently available. Vaccine makers are already planning ahead in an effort to address the immunological challenge posed by variants. At the end of March, Moderna shipped supplies of a booster vaccine against the B.1.351 variant to the National Institutes of Health, NIH, for Phase 1 clinical trials and reports that its own Phase 2 clinical trials on the boosters are already underway. In a statement released on April 20, 2021, Moderna's Chief Executive Officer Stefan Bancel said that recent preclinical results have shown that our variant-specific booster candidates were effective against COVID-19 variants of concern, and we hope to continue to see positive results from the clinical studies. Moderna's variant-specific vaccine candidates include one specifically targeted against the B.1.351 variant and a multivalent booster, for any variant, that combines the company's original vaccine and their shot offering protection against B.1.351 in a single dose. Moderna notes that its current vaccine provides neutralizing activity against current variants of the virus, but that booster doses are intended to increase that immunity. How much of a threat are variants? The Centers for Disease Control and Prevention, CDC, created 3 classifications for SARS-CoV-2 variants: a variant of interest, a variant of concern, and a variant of high consequence. The CDC has not identified any variants of high consequence in the US. The B.1.351, first identified in South Africa, spread to several states, according to the CDC. It is more easily transmissible than the original forms of the virus. Most of the vaccine companies are in fact developing and testing booster shots of their vaccines, and importantly, I think, to note, is that this booster will likely cover the most extreme variant that we know of, the South African variant. There are 5 variants of concern currently circulating in the US. 1. B.1.1.7. This variant was first detected in Britain. It was identified in the US in December 2020. It is more easily transmissible and appears to cause more severe disease than the original virus. 2. B.1.351. This variant was first identified in South Africa in December 2020 and has been known to be in the US since the end of January 2021. It is more easily transmissible than the original virus, and the current vaccines may be less effective against it. 3. P.1. This variant was initially identified in Brazil and Japan in early January. It was first detected in the US in January 2021. 4. B.1.427 and B.1.429. These 2 variants were first identified in California in February 2021. These are slightly more transmissible than the original virus. 5. This variant, officially known as B.1.617, was first detected in India in October 2020. B.1.617 has 13 mutations that result in amino acid changes. Because immunity created by most vaccines wanes with time, booster shots will likely be a necessity. It is not unusual for vaccines to require boosters in order to maintain high levels of immunity. People will need to be vaccinated against SARS-CoV-2 annually because of the decrease in immunity. We have to have a tetanus shot every 10 years and older adults need a pneumococcal vaccine every 5 years, all the more important in the current context of variants emerging. We will have the opportunity to reboost, to revaccinate, and to broaden our protection, and not only make it more long-lasting. The vaccines are also important strategies for reducing the risk of severe illness and hospitalization from COVID-19, as well as deaths. These are the critical efficacy endpoints that will make a public health impact and get us out of this pandemic. The vaccines are providing us light at the end of the tunnel, but we need to ensure global vaccine access because we will not be entirely out of the pandemic until the world is vaccinated. Vaccines alone are not enough. Cautioned against viewing vaccines alone as being enough to turn the COVID-19 pandemic around. Vaccines are enormously powerful tools in public health, but they're not the only tool. As vaccination efforts continue, we need to maximize every tool we have at our disposal, and that does include masks, and it includes distancing, and it includes public restrictions where appropriate. The variants of COVID-19 that are circulating around the world, as well as the waning of vaccine-induced immunity with time, motivated vaccine manufacturers to work on booster shots. It's likely that at some point, even if you've been fully vaccinated, you'll need to get a third dose to ensure lasting protection. A growing number of colleges will require COVID-19 vaccination for fall. Many universities and colleges are requiring their students to be vaccinated against COVID-19 before allowing them to attend fall classes in person. Requiring students to get certain vaccinations before coming to campus isn't a new protocol. Mask wearing, physical distancing, and proper hand hygiene will still be necessary for the foreseeable future. An increasing number of higher education institutions are requiring students to get vaccinated against COVID-19 before attending campuses in the fall. In contrast, only a handful of universities are currently requiring faculty and staff to get vaccinated alongside students. Although it is common for the public to view our colleges and universities as a uniform population of healthy 18 to 24-year-old students, nothing could be further from the truth on most campuses. A COVID-19 vaccination requirement helps to protect those high-risk individuals with herd immunity, as well as protect students, faculty, and staff who have medical and religious exemptions that preclude vaccination. The announcements come a few months prior to the fall semester, giving students plenty of time to get fully vaccinated before the start of the 2021-2022 school year. Require COVID-19 vaccination? Earlier this year, college-age individuals had one of the highest rates of COVID-19 infection, so for a safe return to classrooms, it's important students get vaccinated. Requiring the COVID-19 vaccine not only protects students from the virus but also the people they're in regular contact with, whether it's faculty, staff, or family. U.S. campuses have many students, faculty, and staff at increased to high risk for severe COVID-19 illness and complications, including older age groups, individuals at risk due to economic, social and behavioral factors, community members with high-risk medical conditions, and individuals with obesity. The ACA, an organization of college health professionals representing over 800 institutions of higher education, supports the policies and approaches of educational institutions requiring COVID-19 vaccination for students. Along with most experts in the field of public health and infectious diseases, ACA recognizes that comprehensive COVID-19 vaccination is the most effective way for college campuses to return to a safe and complete on-campus experience for students in fall semester 2021. Experts say that the vaccination requirement eliminates the need for fully vaccinated students to quarantine upon arrival on campus for those who travel from other states or countries. Point 2. It also allows them to participate in performances, events, sports competitions, and other appropriately sized gatherings that are generally considered a part of the college experience. If you are currently a college student, or have a children who have college student, check the updated fall semester requirements for your educational institution. You may be required to become fully vaccinated against COVID-19 before you can attend classes on campus. Exemptions are offered to those with religious or medical concerns. Requiring vaccinations isn't new. Even before the COVID-19 pandemic, schools have required immunization prior to enrollment. Pre-matriculation vaccination requirements for students attending college in the United States are not new. Most U.S. campuses have had vaccination requirements for decades. There are plenty of vaccines recommended for school-age children, which include chickenpox, varicella vaccine, measles, mumps, rubella, MMR vaccine, diphtheria, tetanus, and pertussis, DTaP vaccine, polio, IPV vaccine, human papillomavirus, HPV vaccine, hepatitis A vaccine, hepatitis B vaccine, yearly flu vaccine. These shots are especially crucial in campuses and dorms where vaccine-preventable diseases can easily spread. Aside from the shots that students are required to get through grade, middle, and high schools, most colleges require that students receive the meningococcal, meningitis, vaccination. Some campuses this past academic year also required that students get the influenza vaccination as well. Some individuals raise the issue that the 3 COVID-19 vaccines available in the country only have the Food and Drug Administration's, FDA, Emergency Use Authorization, EUA, instead of full approval. It is not yet a given that one or more of the vaccines will win full approval by the fall. Although many legal experts have stated that an EUA status does not preclude an institutional vaccination requirement, college and university leadership will need to have in-depth discussions with their general counsel about this issue before settling upon an approach. The EUA was based on vaccine safety and efficacy from clinical trials and the current risk of exposure to SARS-CoV-2, the virus that causes COVID-19. This risk is even higher for students who are constantly sharing rooms and unable to maintain physical distance. Additional measures to protect students. Colleges and universities may have the power to require certain vaccinations, but vaccines alone aren't enough to make a return to in-person learning run smoothly. Colleges need to have more safety measures in place to protect their students, including offering vaccination on campus in case of vaccine supply limitations in states where students come from, providing facilities for a student to isolate until they are fully vaccinated, constructing a strong plan and protocol in place regarding vaccine requirement exemption due to religious, medical, or personal concerns, establishing direct communication with students to address their questions and concerns regarding the COVID-19 vaccines, monitoring local COVID-19 infection rates to be prepared to adjust to evolving public health recommendations. Among the challenges of requiring students to get the COVID-19 vaccine include students following through on getting both doses. The Johnson & Johnson vaccination would have been great for students, because it is a one-time shot. Unfortunately, with the pause on that vaccination, in particular, efforts would have to be stepped up to get students to come back for the second shot of Moderna and Pfizer vaccines. It'll be crucial for universities to ramp up their efforts for vaccinating as many students as possible before the end of this year's spring semester. Masks and physical distancing remain necessary even with vaccination. It's important to keep taking the safety precautions already set in place for the time being. Masks should still be worn as we have seen the COVID-19 virus mutate several times. Until we have control over the variants and vaccines that address them, wearing masks and social distancing will be necessary. If booster shots are needed, then those shots will need to be made available to everyone. Even if the majority of student bodies get fully vaccinated, it's too soon to begin rolling back precautions. Within campus grounds, students don't just interact with other students, but also faculty, staff, and visitors. They may also go home to their families, visit other locations to conduct research, and more. Students regularly mix with other populations, so preventing transmission is crucial for protecting students and the greater community. Until a college can be sure that they have reached herd immunity, experts say is 75 to 80% of the campus population immune by vaccine or infection. Mitigation strategies remain critically important, including masks, physical distancing, hand washing, and avoidance of large crowded group settings. It will take some time before educational institutions return to complete normalcy. At the end of the day, we have to remember that it took 3 years for the country to come out of the influenza pandemic of 1918. Despite the advances in science and medicine, we still may not be back to normal by the end of the summer. Please like, share and subscribe to my channel. Thank you for watching. See you on my next videos. Ma salama.